being your best healthcare advocate. Brought to you by Excellus Blue Cross and Blue Shield. The healthcare system can be complicated and, for many people, intimidating. Taking charge of your personal health begins with becoming informed about your healthcare benefits, identifying and engaging with a primary care provider, PCP, and understanding how to follow treatment plans or recommended preventive services. Your PCP is the doctor you see for routine checkups or when you're sick. It is important to have a provider who understands your health status and can coordinate your care if you need treatment from other specialists. You should always have your medical records from other providers you see sent to your PCP. Women should also have a gynecologist and follow recommended preventive services for reproductive health. Pharmacists are a great resource and can help you understand and manage your medications. Using the same pharmacy for all your prescriptions helps minimize the risk for potentially harmful drug interactions. Take some time to understand what your health plan covers, what out-of-pocket costs you will be responsible for, and whether you will need to get prior authorization for certain services. Make sure all of your doctors and preferred hospitals participate with your health plan, and if you are covered for out-of-network services. Your health plan website or customer service center are helpful resources. An important step in managing your healthcare is to create a record of your personal health information. This should include your personal health history, including current and past diagnosis, medication, injuries, and hospital stays. Include your family history as well. Especially note conditions like cancer, heart disease, or other diseases that have been present in your family. You should also include the names and contact information for all of your doctors, as well as a personal emergency contact. You can use paper or online tools to create and update your personal health record. This information should be shared with all of your medical providers and any family members or caregivers that you have designated as partners in your health care. Advanced care directives are important tools for your personal health record. They allow you to designate a healthcare proxy, someone authorized to make medical decisions on your behalf if you become unable to speak for yourself. A website where you can find complete information about advanced care directives will be provided at the end of this presentation. When you are preparing for medical appointments, determine what the appointment is for. Are you looking for a diagnosis or is it a routine checkup? Make a list of any questions, symptoms, or changes in your health status since your last visit. Bring a list of all your medications, including supplements and over-the-counter medicines. This list should include the dosages for each and how frequently you take them. Make sure you understand all of the doctor's instructions before you leave the office. Find out how you can follow up if you have questions after you leave. You can take an active role in preventing medical errors. Always be informed about any procedure or service you are having. When choosing a hospital or treatment facility, do a little research to find one that has done a high volume or specializes in the type of service you need. Have a designated family member or friend serve as your health advocate, someone who can attend appointments with you and get information from your providers. Ask questions about test results, medications you are being given, and why you are receiving a course of treatment. Be informed, engaged, and involved as possible in all levels of your care. Your primary care provider should be your first source of contact for new, persistent, or worsening symptoms. Many providers have after-hours care or phone numbers. If you have an injury such as a burn or a sprain, an urgent care center can be a good alternative if your provider office is unavailable. For life-threatening conditions, head to the emergency room. Be sure to bring copies of your personal health record if possible. After any treatment in an urgent care or emergency room, follow up with your PCP. Here are some resources to help you learn more about becoming an informed healthcare consumer.